I was interested in looking at the education of residents across residency programs because when I was a resident myself, I don't feel like I got enough vaccine education in my training. And then I realized in talking to other medical professionals that they had similar experiences. And some people got great training if they were under a mentor that is a vaccine expert. So I just felt like it wasn't fair that you would get great training if you happen to be in an institution with a vaccine expert versus if you were in an institution where you were just learning vaccines, wherever you could pick them up. So when I became attending at the hospital where I'm at, I decided to create a curriculum for residents. And I started teaching it. But the problem is I would show up at classes as only a third of the residents would be there because 1/3 would be post-call, so away sleeping, and 1/3 would be seeing patients. So even though I had what I thought was a comprehensive curriculum, I was not reaching all the residents. So that's how the idea of creating a flipped classroom technology vaccine education curriculum that could be implemented across any institution was born. So we decided to get some funding, we created a curriculum, and we did a randomized clinical trial to see if it had any effect on the residents' knowledge, attitudes, and confidence towards talking to parents about vaccines. Flipped classroom technology is basically, simply put, instead of having a classroom be face-to-face, you do online modules, and people can access them on their phone, their tablet, their computer, anywhere. And the way that we designed them also, you could be in the emergency room in between patients, watch the module for 5 minutes, stop, keep seeing patients, come back, keep watching it. So you don't have to do the full hour continuously. These modules are not like a chapter that is just written and done. They're live, and we continuously update them so that if we find that there's hesitancy in a particular topic, for example, flu this year has low effectiveness, we can create a module to address those concerns in real time so that the people accessing the modules have the tools necessary to be able to answer questions intelligently and with current data to their patients. So we used 26 institutions across the United States, and we randomized them. Half to get the curriculum, half did not get it. We did a survey prior to the intervention and a survey after, and what we found that knowledge was not as high as we would have liked for our young residents to have, even at the end of the residency training program, and that thus knowledge could be improved. But more importantly, we found some hesitancy among residents, which was surprising and a little bit alarming, because these are the physicians that are going to be in the front lines talking to parents about vaccines. And we're letting them graduate and go out there without that knowledge and without the skills. They also told us they don't feel confident addressing parents' concerns and questions. And when we did the intervention, we found that the curriculum helped them feel more comfortable. They told us in qualitative data that they were able to immunize families that they had not been able to immunize before, because after taking the curriculum, they had the self-confidence and the knowledge to be able to adequately address parental concerns. And also they are scoring better on their boards with vaccine-related questions, which of course makes them happy. But we noticed a very big shift in how they address parental concerns and feeling more confident about it. Before they walked in to see a patient, they would pull a module and review what I had told them, and then they were able to even show it to the parents and say, look, here's this data, and they can use that as a tool to be able to help them answer questions that they might have forgotten how to answer, but because it's there with them at all times, it's easy for them to use it as a reference. So this was just a pilot project, and we only created the module for the first year residents. What we want to do is get more funding to do a comprehensive curriculum for first, second, and third year residents. And then we want this to become basically a curriculum that is implemented across all residency programs in the United States. We're starting with residents, but the goal really down the road is we want to be able to educate all healthcare providers, nurses, medical students, OBGYNs, specialists, anybody that wants to get the curriculum, we would like to adapt it for them.